Hi guys, I am coming to you, as you can see, from my car today. I just came in from a doctor's appointment. A week ago I went in for an endoscopy, and basically what that is when they put a camera down your throat to check to see if you have ulcers or what's called a hiatal hernia. It was pretty routine. I went to the hospital, I got admitted, changed into the hospital gown. The nurse came in and took my vitals, prepped me for IV. The anesthesiologist came in and asked me a series of questions, trying to determine if I have any allergies, my medical history, if I drink, if I smoke, etc., etc. And then my doctor also came in to check on me, just to reassure me that it's a quick procedure and I should be in and out probably in 30 minutes as far as the endoscopy itself. When I got done with the endoscopy, then I went into the recovery room, and I was probably in there for about 15, 20, maybe 30 minutes as I came out of anesthesia. They gave me instructions not to, make any decisions, don't sign any contracts. And my husband was there to drive me home. And then I was instructed to go back to see my doctor in a week to get a report on the endoscopy. So I went in to see my doctor today. Now, he did tell me that I do have ulcers in my throat. He also told me that I do have a hiatal hernia, which basically means that a part of my stomach is coming up through my diaphragm, and that is usually a cause of really bad acid reflux, which I have really been struggling with for quite a while. We went ahead and set the date for my surgery, and they're just waiting authorization from my insurance company because I will need to stay the night at the hospital. And then, of course, he gave me some instructions as far as starting my liquid diet 2 weeks before my surgery date. And that was pretty much it. I'm nervous, excited. We're just waiting for that authorization. Hey guys, here I am getting ready to go in for my ECG. I can't pronounce the proper word for it, but basically it's where they go in with a camera through my throat and they check my stomach to make sure that everything is okay. Check to see if I have a hernia. If I do have a hernia, then while I'm going through my actual VSG surgery, then my surgeon can try to fix that. I have a really bad acid reflux, so I'm sure they're also trying to check to see if I have GERD, which is gastroesophageal reflux disease. I know I just butchered that. Anyways, I will talk to you guys again right after I come out from the ECG.
So there are multiple different types of weight loss surgeries available to us. Okay, I won't be able to go through all of them with you, but I can talk to you about a couple of the most popular ones. And the one that's the most popular now is called the sleeve gastrectomy. And I have a picture here for you. And this shows how the sleeve or the stomach is reconstructed after the surgery. It basically limits the volume of your stomach and it removes the hormone producing cells of that part of the stomach. And that helps you have early sensation of being full so that you have early satiety, you don't eat as much. And then the physical aspect of the sleeve is small enough that you feel full sooner. Okay? So that's why I warn you that with the sleeve, you need to be cognizant that the volume of food and drinks that you take in is going to fill up that sleeve very quickly. Okay, you can have that full sensation. You need to be disciplined enough to stop eating and drinking, okay, or else you will have that regurgitation symptom, okay?
And how long is recovery?
This is a overnight surgery. So we do the surgery. It typically takes less than an hour. You're spending the night at the hospital just for us to make sure you're doing okay. We do an upper GI contrast study in the morning just to make sure everything flows through okay. Once that study is completed, then we advance you immediately to what's called a bariatric clear liquid diet. And then after that, you go home on that for a couple weeks. And then we have instructions for you to follow to slowly advance your diet over the course of the next 6 weeks.
What are some of the possible complications?
So complications with any surgery is always going to be bleeding and infection. You know, the stomach is pretty well vascularized. There's a lot of blood flow to it. And so we take a lot of care during the surgery to make sure that there's no bleeding. And then the other complication could be a leakage. That's probably the most devastating complication. Extremely rare complication though. The way we construct it, we try to ensure that that doesn't happen. And that's one of the reasons why we do an upper GI study. And to this date, none of my patients have had any leakage that's seen on the upper GI study right after surgery. So.
And how long does a procedure normally take?
It takes less than an hour.
Okay. Well, thank you very much for your time, doctor.
Yeah, you're very welcome.
And I will keep you guys updated on the day I go to the surgery and subsequently. Hope this information was helpful. If you like this video, please go ahead and hit the like button, hit the subscribe button, and hit the notification bell so YouTube can let you know when next I upload a video. See you in the next video. Au revoir.